Your hands age faster than any other part of your body, and almost every anti-aging conversation completely ignores them. Creams, serums, fasting protocols. Nobody talks about what's happening inside the architecture of your hand. There's a finger position so specific, so mechanically precise, that yogic masters used it to maintain grip strength, skin integrity, and nerve sensitivity well into their 80s. Modern hand therapists are quietly rediscovering it. Tonight, with one forgotten finger lock, you can begin reversing what most people assume is inevitable. Your hands aren't deteriorating because of time. They're deteriorating because the signals that kept them alive have gone quiet. Think about what hands were built for: gripping, climbing, pulling, pressing, pinching, ringing. For most of human history, hands worked against resistance for hours every day, kneading dough, pulling rope, working stone and soil. Every one of those actions was loading the fascia, stimulating microcirculation, and firing the intrinsic muscles that live between your knuckles. Your hands were built for that complexity. But keyboards, touchscreens, and steering wheels stripped all of that down to a single flat gesture: the tap. Now we hover, we swipe, and we grip almost nothing. Tendons shorten, synovial fluid thins, microcirculation retreats from the fingertips inward, and the collagen scaffolding that gives skin its structure starts to collapse, not because your body forgot how to make it, but because it stopped receiving the mechanical signal to bother. Classical Indian medicine didn't call this aging. It called it prana stagnation, life force without a channel. Modern biomechanics calls it mechanical unloading atrophy. Same deterioration, different language. In the Hasta-Vigyan texts of classical Hatha Yoga, manuscripts dating back roughly 1,200 years, the hands were never described as tools. They were described as antennas. The fingers were mapped to specific meridian pathways, each one corresponding to an organ system, a nerve cluster, a bioelectric current. The specific lock we're discussing today was called the Vajra Mudra, the thunderbolt seal, and it wasn't practiced for symbolism. It was practiced because masters noticed that specific finger compression patterns produced measurable changes in sensation, warmth, and what they described as internal brightening of the limb. Here's what happens inside your body when you perform this lock correctly. When you apply precise lateral pressure between the index and middle finger while simultaneously extending the ring finger against resistance, you activate something called the dorsal interosseous muscles, the deep intrinsic muscles almost nobody trains. These muscles sit between the metacarpal bones, and they're responsible for the spread and stabilization of the hand. Because they're almost never loaded in modern daily movement, they atrophy quietly. When you re-engage them through specific positional resistance, you trigger a cascade. Blood flow increases to the dorsal capillaries, lymphatic circulation in the hand improves, and, critically, you stimulate the mechanoreceptors in the periosteum, the thin membrane surrounding your finger bones. That stimulation sends a signal through the median and ulnar nerves, up through the forearm and into the brachial plexus. Your nervous system registers the hand as active, and it responds by upregulating collagen synthesis signals in that region. Researchers at the University of Copenhagen published findings in 2019 showing that targeted intrinsic hand muscle activation was associated with measurable improvements in dermal thickness and grip force in adults over 50, changes typically attributed only to resistance training of larger muscle groups. A separate study from Kyoto University's rehabilitation department noted that participants who performed daily finger opposition and spreading exercises for 30 days showed a 31% improvement in capillary response time in the fingertips, essentially how quickly blood returned after compression. The researchers noted this was comparable to markers they saw in subjects who were 20 years younger. Ancient practitioners didn't have the language of capillary response time, but they describe the same phenomenon as the hand awakening from sleep. Your body just calls it circulation. You can feel this immediately. When you hold the Vajra lock correctly for 60 seconds, you'll notice a warmth that starts at the base of your fingers and spreads toward your palm. That isn't imagination. That's vasodilation. Increased blood moving into tissues that have been running cold and slow. Your tendons will feel slightly stretched in a way that is unfamiliar but not painful. That's the dorsal fascia being asked to do something it hasn't done in years. The technique is called Vajra Mudra Lock, the thunderbolt seal, and it takes 90 seconds. Sit or stand with your spine upright. Let your hands rest on your thighs, palms facing up, fingers relaxed. Take one slow breath in and out before you begin. You can do this at your desk, in a chair before bed, or first thing in the morning before you pick up your phone. Beginner version. Bring your right hand up. Gently press your index finger and middle finger together with firm lateral pressure. Not crushing, just intentional contact. Simultaneously, extend your ring finger away from your middle finger as if you're trying to create space between them against light resistance. Hold your thumb gently against the side of your palm and let your pinky rest naturally. Hold this position for 60 seconds. Breathe slowly. Key focus. Feel the muscles between your knuckles engage. That mild, deep ache is your dorsal interosseous muscles waking up. Common mistake. Don't grip or tense your wrist. The wrist stays soft. Intermediate version. Add a slow, deliberate finger spread after the 60-second hold. Open all 5 fingers as wide as possible for 5 seconds, then return to the lock. Repeat this open-close cycle 5 times. This amplifies the fascial loading and increases the circulatory flush effect. Advanced version. Perform the lock with both hands simultaneously while maintaining slow nasal breathing in a 4-count inhale, 6-count exhale pattern. The extended exhale activates the parasympathetic system, which researchers have shown enhances peripheral circulation, meaning more blood reaches your fingertips during the practice. Mastery marker. When you can hold the bilateral lock for 3 minutes with full finger extension and controlled breathing without your shoulders rising, you've integrated the full pattern. Beginners. Once daily, either hand, for 1 week. Maintenance. Both hands, 90 seconds each, 3 to 4 times a week. Mastery path. Daily bilateral practice, building toward the full breathing integration. First session. You'll feel the warmth and the unfamiliar muscle engagement. After 3 days, morning stiffness in your fingers may begin to lessen. After 7 days, you may notice improved grip awareness and subtle changes in how your hands feel at rest. After 30 days, the changes in circulation and muscle activation should be noticeable. Softer joint movement, more responsive fingers, and skin that may feel less papery at the dorsal surface. If you experience sharp pain, numbness that doesn't resolve, or any joint swelling, stop and consult a physician before continuing. This isn't hand care. This is nervous system literacy. The wellness industry tells you hand aging is cosmetic. Treat the surface, and you've done your job. Traditional medicine has always known that the hand is a window into systemic vitality. In classical Ayurvedic diagnosis, a physician would assess a patient's hands before anything else. Not as superstition, but because the microcirculation, skin tone, nail bed color, and joint mobility of the hand told a story about what was happening in the liver, the heart, the lymphatic system. Your hands aren't old, they're understimulated. For thousands of years, humans maintained hand complexity without thinking about it, because life demanded it. We didn't need hand therapy because we had survival. We wrung, pulled, pressed, and pinched our way to functional hands well into old age. You just learned what yogic masters considered a foundational practice, not for flexibility, not for spirituality, but for longevity of function. The goal isn't younger-looking hands. That's the side effect. The goal is hands that stay capable, responsive, and alive. Tonight, try the beginner lock before you sleep. 60 seconds. Feel the warmth. Tomorrow, notice how your hands feel when you first wake up. In 7 days, you might be surprised what was simply waiting to be turned back on. And if this found you at the right moment, you know what to do. As always, keep moving. Talk soon.